Thank you for joining the presentation on all things oral microbiome. I'm Brian. I'm one of the co-founders here at Bristle, who works with our provider partners. In this talk today, we're going to discuss the different types of salivary diagnostic tests available and how you can interpret their results. We're going to clarify how you can use those results to develop your treatment plan, including management of tooth decay, gum inflammation, even things like halitosis, as well as how you can get insights into overall health, including gut conditions, nitric oxide production, and others. And then we'll also discuss how we nourish and nurture those beneficial bacteria with diet and other lifestyle changes. So as a reminder, when we're referring to the oral microbiome, we're referring to the community of bacteria, fungi, and viruses that live in the oral cavity. There's over 700 plus unique bacterial species that make up the oral microbiome. It's actually the second most diverse microbiome behind our gut. And decades of research and literature have shown that disease is driven by an imbalance of certain pathogenic microbes. And by detecting this imbalance early and actually managing it, we can actually mitigate the progression of different diseases. And within the mouth, there's no niche that these bacteria haven't colonized so far. So you can see all around the mouth, from the back of the tongue to the teeth, to the gum lines, whether there's oxygen or not, these bacteria have found a home and made up a niche. And because of that, we'll see them behaving in different ways and leading to different types of interventions or different types of treatments, actually impacting them in different ways. And when we talk about oral disease and the oral microbiome, what we're really getting at is this idea of symbiosis or homeostasis versus dysbiosis. So symbiosis, as we know, we have not just the bad bacteria in the mouth, we have the good as well. And when a microbiome is healthy and happy, you can imagine it like a garden where we have a number of different types of plants. We have shrubs, we have grass, we have apple trees, and they all colonize and behave as a community and work together. And they create, it makes it difficult for things like weeds or other unwanted plants to sprout up and to actually start taking up space. But now we can imagine if some of those nice plants we grew ended up dying, that'll allow for a lot more space where these weeds or other invasive species can come in and actually do a lot of harm to those other species in the garden. Very similarly, in the mouth, we can refer to that later state where things are out of balance as dysbiosis. And what this looks like in the oral cavity is that in a healthy mouth, we typically see pathogens are only about 10% or less of the total community. But when we see it shift towards a disease state, this is where we can actually see the pathogens take up almost about half of the microbiome or constitute half of the community. So a rapid shift in that community balance. And when the way we see this presented in oral disease, obviously, in one sense, is in caries. So certain pathogenic microbes that live on the surface of our teeth break down our foods and different items from our diet into acids that produce decay. And on the flip side, our commensal bacteria actually can play a role in reducing caries risk by releasing pH neutralizing molecules like ammonia, or actually releasing things like hydrogen peroxide or bacteriocins that can suppress the growth of these bacteria. Similarly, in gum disease, these tend to be more anaerobic bacteria that live where there's no oxygen in the gum line. And we know there's over a dozen different species that can actually lead to inflammation, often working together to cause inflammation and lead to gum disease. And again, we can look to our commensal bacteria as one of our best defenses, where they can both compete for space, like in the garden analogy, but also similarly, they can produce these compounds that will prevent the progression of these anaerobes, actually harming them with molecules like hydrogen peroxide. And similarly, they can also train our immune system to recognize these pathogens and to actually not cause as much inflammation by secreting different molecules and interacting with it. So really, coming back to this idea that our commensal bacteria are one of our best defenses against oral disease. But it's not just cavities and gum disease. We see an imbalance of certain oral bacteria connected to other conditions like chronic bad breath or halitosis, where these bacteria will release volatile sulfur compounds. Or if we look at things like gut inflammation, where we can actually see species like Fusobacterium nucleatum and Campylobacter can actually translocate to the gut and are associated with conditions like IBS, IBD, and Crohn's disease. Other things like burning mouth syndrome have actually been tied to viral infection, as well as oral thrush, as we well know, can be caused by multiple different Candida species, with tongue coating also being a symptom, but also having different bacterial causes. So really looking at a breadth of oral diseases that can be rooted in these oral bacteria. But it also doesn't stop in the mouth, as we mentioned the gut inflammation example, but looking towards more serious diseases like cardiovascular disease, colorectal cancer. F. nucleatum has been associated with the severity and the risk of progression of colorectal cancer. But also looking at things like adverse pregnancy outcomes and actual diabetes risk and neurodegenerative disease. We're constantly learning about the different ways these oral bacteria can impact our systemic health. And so really bringing the mouth into the body in the sense of we need to be able to manage these oral bacteria to prevent their impact on these different conditions. So now I'm going to touch on different testing methods that we might be familiar with for profiling the oral microbiome. And so there's a few different techniques that have come into prominence for profiling the oral microbiome. So if we go to the far right over here, we're looking at conventional microbiology. This is where you're typically looking at cultures and taking a sample and then measuring and monitoring which species are growing, really just looking for the presence and absence of certain species. But it doesn't give you a great comprehensive view of the microbiome, and it's also quite laborious, particularly trying to run cultures in a dental practice. If we take a step to the left in the middle, we have qPCR, which has typically been one of the most common ways to profile oral bacteria. It's great for measuring the presence and absence of certain bacteria, but you are looking at specific bacteria each time. So this means when you're trying to look at the community-wide, when we're talking about 100 to 200 species in each person, it can get quite expensive to do that. And so not great for starting to understand that community health. And then on the very left, we have shotgun metagenomics. This is actually the technique we use at Bristle, but it's great because it gives you, we're not looking for specific targets. Instead, we're taking, as the name implies, a shotgun approach, where we're looking at the entire community of bacteria and fungi, and even some parasites, and also getting the whole resolution. So we can look at the genes of each of these bacteria and really start to understand what they're doing in the mouth. So we're no longer limited to just looking at the harmful pathogens. We can instead look at the whole community and really understand those relative abundances of good, bad, and other. And highlighting this point, when we look at an approach like qPCR, this is giving you a measure of absolute abundance. So it's really measuring the amount of just that bacteria. It's typically represented in copy numbers or in actual copies of that bacteria. Versus with shotgun metagenomics, what we're really interested in is relative abundance. So harkening back to earlier slides, we really want to understand what is the ratio of those harmful species to the beneficial bacteria that we know may be playing a role in maintaining balance. And to just illustrate that point, we have an example here where we have two patients where if we were using a technique that used absolute abundance measurements, we could find that they have 5 genome copies per milliliter of this pathogen. And we can look at each of them. And so from this test, we would assume that they'd be at very likely the same risk of disease from that bacteria. But when we can start to look at what that abundance is compared to the beneficial bacteria, we see that patient 1 has a 50-50 ratio of the pathogenic species to the beneficial bacteria. So this patient is actually at a much larger risk of oral dysbiosis, versus patient 2, where we see that the pathogens are only constituting about 10% of their microbiome, is very likely actually in a healthy state. So although in absolute terms, they have the same amount of pathogenic bacteria, when we look at that community-wide view, we can actually see quite different outcomes. And we tend to see this validated when we look at patient samples. So now getting into Bristle and our testing overview. So as I mentioned, the Bristle Oral Health Test is the first test that analyzes the complete oral microbiome. So all 700 plus bacterial species and fungi. And we're looking at both the beneficial and the pathogenic species. What this allows us to do is give you those oral health insights you're looking for, but also start to give you systemic insights, looking at things like gut inflammation or nitric oxide production. We'll also provide a full breakdown of all the bacterial species we detect, and that'll enable us to start getting more personalized with the types of diet and oral care recommendations we're giving patients based on their results. And here's just a snapshot of some of the insights we deliver in the report. So you can see, rather than giving you just a list of 100 to 200 or more bacteria, we organize them into scores. So you can see an example here where green is good. That means below average risk of that condition based on the bacteria related to it. Yellow would put you at average risk, and then red would put us at a higher risk of that condition. And this includes insights for gum inflammation, tooth decay, bad breath, as well as things like gut inflammation. Also touching on those beneficial bacteria I mentioned. And one of the latest insights we've actually included is our nitrate score. So giving you now a way that you can measure the bacteria in the oral cavity that produce nitric oxide from nitrate. And I'll get into now on the next slides how you can use these types of insights in actual care with your patients. But first, I want to just highlight a recent addition to the report. So one of the key benefits of profiling the complete oral microbiome as we do is that as new discoveries are made, we are able to rapidly include those into our report. So we have an example here from just a few weeks ago where Pseudomonas sputagina had been discovered as an enhancer of strep mutan's ability to produce tooth decay causing acid. So once we saw this discovery and were able to validate it, our team could very easily add that into our tooth decay score now. And we now include that in every future Bristle report. So as new discoveries are made, we're able to learn quickly and give you those insights that you can then use in your care and deliver to patients. And then, as I mentioned, we're really getting to a point where we're going to be able to start to tailor both diet and oral care recommendations for patients. So in the report, we'll include recommendations along things like toothpaste, different gels, or mouth rinses, also helping you determine which probiotics or chews might be most effective for your patients. As we know, new probiotics are constantly coming to the market, so giving you insights on which will be most effective for each patient. Then also getting into things like diet and lifestyle tips. So being able to advise patients on if they benefit from adding nitrate to their diet or possibly adding other different supplements. And so now getting into the use cases of how you can use the Bristle test. One of the real questions that we can help answer is this conundrum of to drill or not to drill. So as you're doing precision treatment planning in your practice, you're constantly collecting data. And the more data you have, obviously, the better decisions you can make for your patients. And so this data takes many forms. It includes your clinical exam, the patient's diet and hygiene history, radiographs, the restorative history. I'm sure some of you even take it a step further and understand even more about your patient. But often can still be left in scenarios like this, where when we look at the radiograph, we see this incipient lesion, and we're still left with this question of, is this something we want to address now, or is it something we want to monitor, to drill or not to drill? And so we'll work through the types of data we normally collect, the clinical exam, patient hygiene and diet, radiographs, but can still be left with this question of, is this a site where we're actually seeing worsening decay and the patient is at risk of this becoming a bigger issue, or is it something that we're going to monitor? And so now with the Bristle test, what you can imagine doing, and here's two patient results here, where we can see the patient on the right is at a very high risk of tooth decay. So they have a very high abundance of the bacteria present that lead to decay. Versus the patient on the left, we actually found no abundance of the bacteria related to tooth decay. So now you can start to factor in the presence of these bacteria into your decision-making and into that type of data you're collecting, where perhaps for this patient on the right, we're going to go ahead and drill because the lesion has a high risk of progressing in the next 6 to 12 months, versus the patient on the left here, perhaps that's something we're just going to monitor because we believe there's a lower risk of that lesion progressing. Similarly, for periodontal patients, we start to answer this question of what's the severity of the infection. So everyone here is very familiar with this chart, where we can actually stage the progression of periodontal disease based on our clinical indications. But one of the things that can be hard to determine is how rapidly is a patient progressing further down to a more severe stage of gum disease, or are they in a state of stability? And this damage is from their past, and now they've actually got a healthier microbiome, or we've gotten it under control. So similarly, what you can imagine with the Bristle test is actually charting the patient's current state up at the top and using the Bristle report as an arrow to help guide you towards where this patient's headed. So in this example, we might have a patient who's presenting as healthy, but if we see they're at a high risk of gum inflammation, they're actually likely headed towards a worse state and likely headed towards gingivitis. Very similarly, if we saw somebody at stage 1 or stage 2, but on their Bristle report, we saw a very low abundance of gum inflammation causing bacteria, this is likely a patient who we've gotten to a stable state. And so we may not need to have as soon of a recall on this patient. So really starting to understand not just where the patient is today based on our clinical observations, but where they're headed based on the microbial information we're now detecting. Another common use case we see with the Bristle test is patients with halitosis. And halitosis we know can be very frustrating. Patients can try all sorts of different approaches and often not see results because what we've found is halitosis isn't a one-size-fits-all condition. We've actually been able to identify 6 different types of halitosis based on oral microbiome results. So based on the bacteria that we detect in the mouth that release volatile sulfur compounds, we can start to give insights into which types of treatments will be most effective for that patient. So down here in the bottom right, for example, we have my results. So I'm actually more prone towards tongue coating bacteria. So you'll always catch me tongue scraping twice a day because that approach is going to be most beneficial for me since I know I'm prone to tongue coating species. Versus if we have a patient who has a high abundance of gum-related or gum-line bacteria, that's somebody who would probably benefit more from flossing approaches or something like a water flosser. So again, starting to give patients insights into the root cause of their conditions so they can effectively treat it and manage it. But it's not all bad. As I mentioned, our beneficial bacteria, our beneficial buddies, as we refer them to, are a key component of our oral health. And now we can actually start to give those insights to patients and use them to manage and care. So again, our commensal bacteria, they play a number of key roles in our mouth, both for maintaining homeostasis, preserving the balance between beneficial and pathogenic microbes, but also going a step further with releasing hydrogen peroxide or bacteriocins that suppress the activity of bacteria, and actually training our immune system. So they really are our superhero defense in the mouth. But we haven't had a good way to date of actually measuring what is the commensal bacteria abundance in each patient. And now with the Bristle report, we can actually measure those beneficial bacteria. And going back to that example I mentioned earlier, we may start to understand why 2 patients with a high gum inflammation score or a high abundance of gum inflammation bacteria may differ in their disease progression. So if we look at this example on the right, just because a patient, we could imagine if these two patients both had a high gum inflammation score, the patient on the top may actually be at more of a risk of disease progression than the patient at the bottom because they have a higher abundance of these commensals protecting them from the progression of inflammation. And we'll often see this when we're looking at Bristle report, where patients, even if they have a moderate or higher risk of gum inflammation, may not be presenting clinically because of these commensal bacteria. And the other key point here is it's enabling us to move the conversation to, instead of just focusing on the pathogens, really start to encourage our patients and motivate them about moving to oral wellness and getting to this idea that they can be building up their best defense through things like good hygiene, good diet, and even things like oral probiotics or other approaches they can take. Another key function of these beneficial bacteria is nitrate reducing. So specific bacteria in the oral microbiome actually convert nitrate that we get in our diet to nitric oxide. And nitric oxide is a very important molecule in the body. It helps with blood vessel dilation, which has key benefits to both our heart and brain health. And now, again, with the Bristle report, we can use this nitrate score to really understand, to measure the bacteria in our patients' samples to see if they have the abundance of nitrate-reducing bacteria, or if they want to start to incorporate approaches like increasing nitrate in their diet through beets or leafy greens. One key note here is that we're not measuring nitric oxide itself, as you do get it from other sources like proper nasal breathing, but that this can be a key component of breath work or of a patient on their work of increasing nitric oxide production. It's making sure we're not missing the bacterial component and actually giving them a way to track the progress over time. And ultimately, one of the things we're most concerned about is, did we make this patient healthier? And how do we know? And so another exciting feature we have is that we can track progress over time. So we can take this first test and, although we see a high abundance of gum inflammation through interventions in the office, diet, lifestyle, other treatment interventions, we can actually track their progress and hopefully see lots of green reductions of these pathogenic species and get more of our patients into the green. And so in terms of key benefits of salivary testing and Bristle testing, one of them is increasing treatment acceptance with quantifiable data. So as patients, it can be difficult to understand why I should care about a 5 millimeter pocket or a 6 millimeter pocket or bleeding on probing. But when I see a quantifiable report, it can be a lot more motivating to understand that I'm in the red of gum inflammation, and I can see that I have bacteria that are associated with pretty nasty things, both in the mouth and around the body. And this can then in turn encourage and engage patients and motivate them to embrace both at-home hygiene and in-office care. And we actually see that with Bristle users we survey. Over 80% report adopting our recommendations, whether that be starting to floss, using something like a probiotic, or actually changing their diet. So really seeing this type of data can resonate with patients. Other key benefits include actually being able to really monitor the efficacy of different treatments. As everyone on here knows, different patients will respond to different interventions. And now we can really start to understand why and track at the bacterial level, did this intervention work for this patient? Did we actually see that shift in bacteria we were hoping for? Lastly, you can start to individualize your care based on those microbiome insights and really differentiate the practice or differentiate the care you're providing with this whole body and whole health insights into systemic conditions like nitric oxide production and gut health. So in terms of integrating this into the workflow, it's a simple and convenient testing process. So at the beginning of the appointment or even at home, the patient will just collect 1 milliliter of saliva in a tube and register it through our online portal. They'll then send the sample back to our lab in a prepaid mailing envelope where it'll be processed and returned to both you and the patient, the results, online in about 2 weeks. But to simplify, it really boils down to spit, shake, and ship it back to the lab, and you're all set. In terms of pricing, so the test is actually available online. So you don't need to be testing in office, which is a key differentiator of Bristle. So if your practice hasn't yet onboarded salivary testing, but you are interested in using it with patients, we do have that option. If you are using salivary testing in your practice, we're able to offer a discounted rate. So we offer a 20% discount for any volume, unless you order more than 20, then we offer the test for $99 per test. And as I mentioned, we also have a referral program. So if you're interested in referring patients to Bristle, we can get you set up with a discount code. And then we'll also provide $30 compensation back to you or your office for any patient that uses the test as compensation for any follow-up or any consults that you'll be doing with them. Lastly, we wanted to promote that we're here for you every step of the way. We offer free onboarding training and ongoing email and phone support. So if any of you are interested in learning more about Bristle for use with your patients or use in your practice, we're always happy to get in touch. You can learn more at our website at bristlehealth.com/providers. And we're always happy to go through reports with you, answer any questions, and make sure we're all extremely comfortable with the results. And the last thing is we really want your feedback. So we're constantly iterating on the report. And as hygienists, the real patient experts, we take your feedback at the utmost importance and are constantly putting that directly into the product. So good, bad, ugly, we really want to hear from you and get your feedback so we can create something that's extremely valuable to you, both you and your patients. So that's it for the presentation. I just wanted to call out that we're so excited to see you all in Nashville, and you'll be able to find us at booth number 725. We can't wait to meet you.